Yes, hello everyone. This is Dr. Khan, Executive Plastic Surgery. So I've done what is 100% total capsulectomy, 4/22/25, initials LB. So this nice lady, she is in her late 50s. She's had 3 sets of implants. The first one was 1996. Now she said this was above the muscle, the pectoralis major. Then she had a car accident in 2001 and ended up in 2002 getting her second set of salient implants, which she said was below. And then in 2019, she got her third set, silicone implants in Dubai, which were silicone above the muscle according to the patient. Now, the goal was to remove the capsule residual, what was below the muscle here. Now, as I went in, I find out that this implant, the 2019 one, is right on top of the rib underneath the muscle. So this is below the muscle. And remember, my job is, till I have the operative note, I'm always going to assume it's either above or below. So what I did was I removed the entire implant capsule and all of that inflamed tissue completely, sincerely, definitively, such that the entire implant capsule was removed as one system, which is the total capsulectomy. And then around inferiorly, I removed what is the residual inflamed tissue. And this is what was directly above the pectoralis major, abutting the breast tissue, and on the lateral and in the inferior aspect. So what I'm going to do now is I'm going to go ahead and cut this open. Now, one thing I want to mention, so I'm going to go ahead and cut this open. She had what is fibrocystic disease. We'll see that in the pathology. This was grossly speaking. So as I cut this out, you can see this is hard tissue. So I incorporated that. And these implants are from 2019 from Dubai. And so as you will see as I go in, there was a lot of inflammation around. And I can see already this is your textured implant. And you can see how thin the capsule is. If I take the ruler and I put it here, you can see how transparent thin this is. So no matter how thin the capsule is, it has to be completely removed. That's like my practice. You don't want to take any second chances. Do it right, do it once, do it definitively. And as you can see, it's a relatively large implant for the patient's chest. And as I remove it, you will see complete total. So this is your 500 cc implant. Very large. It was sitting over an extensive area. As you can see, if I press this down, it was going all the way medial part of the chest to the lateral. So there's some fluid around, as you can see. And as I will put it here, you can see this is your bleaching of the silicone. And that is part of the culprit. A lot of inflammation around, and I'm overall very happy with how the whole dissection has gone. And complete total capsule removal. The dissection on top of the rib indeed was very, very tedious, and I'm very happy with how everything went. Complete total capsule removal. And so now what I'm going to do here is, if you look at this tissue right here, this is the inflamed tissue at the inferior aspect, lateral, medial, superior, that I incorporated, including some of this muscle, unfortunately, because that was part of the inflamed tissue, as you can see, abutting it. So that complete clean out was done because she had a lot of symptoms. And if you look at this video and look at the video on the chest, you will be only content that the complete clean out was indeed very much done. Now we're going to go over to the left side. So she had a history of squamous cell cancer on her back, on her chest, breast area, and also on her face. So I'm going to send this full thickness skin at the inferior part. This is her inframammary crease incision, you can see right in the middle. I'm going to send this off because of her history of squamous cell cancer, just to be complete. Normally I do not send these. And then, if I may, if you look at this tissue right here, this is that inflamed tissue that was at the bottom, superior, lateral, medial aspect that I removed on top of the pectoralis major. So only good, healthy, viable tissue remained behind. And as you will see, this is an implant, again from 2019, that she had from Dubai. You can see exactly how the capsule was removed. Let me put this here. Overall surgery went very well. A lot of inflammation. It took longer than usual because the dissection was very tedious. If you can imagine the size of the implant and the way the inflammation was, the way it was sitting on, certainly added to the length of the case. Again, as you will see, look how thin the capsular tissue is. I can put my scissor here. You can see how thin this is. So as I cut this open, you can actually hear it being cut. Fluid around, not enough to send. You can see, look how it's, none of this spilled into the chest. And I'm overall very happy. And as you will see, this is your Mentor 450. Mentor 450 on this side. And if I may, look at this leaching of the silicone. So 450 Mentor implant. And again, the capsular tissue, that's so thin, some areas thick. And I'm very happy and content with how the whole dissection has gone. Now, I just want to, for completeness sake, this was done en bloc. If I cut this open, you can see how thick this tissue is. All of it has been removed. So I'm going to put this here. So the implants will be returned to the patient. Capsules to be sent to pathology. Rule out the PLLC, CD30 analysis. Rule out lymphoma. Residual inflamed tissue in the periphery of this implant given by multiple previous surgery. She had actually a lumpectomy on the right side as well, given when she was 35. So I took anything suspicious, remotely suspicious, looks suspicious, palpates, looks different, does not look right. My gut, sixth sense says does not, I remove it, because that way we have complete confidence in the post-op course that all of the badness was removed and only good, healthy, viable tissue remains behind. I'm going to send the skin off as well to pathology, given her history, so that we can rule out if there's any squamous cell component to the skin that was removed for that pseudolymph. So there you have it. This is Dr. Khan. Complete, thorough, meticulous dissection, and the surgery takes whatever length of time it takes so that there's utmost confidence in the goals of the surgery which were met, and so that the patient has the peace of mind that, number one, all of that bad tissue was removed, and number two, all of it was tested, and with complete sincerity. This is Dr. Khan, Executive Plastic Surgeon.